Hi, welcome to Lugin Videos. I'm Lugin Fiamban and I will talk about the way to prevent COVID-19 infections. The evidence continues to grow. There is more and more publications in peer-reviewed medical journals about the possible connection between vitamin D and COVID-19. Several research studies have been done, and the purpose of this is to sort of look at the evolution and the thinking of the use of vitamin D in COVID-19. So, what is the evidence for vitamin D can prevent COVID-19? Alright, let's talk about vitamin D first. The first things you have got to understand is that vitamin D is not just a vitamin. Actually, it's a hormone. And if you noticed here by the structure, you will see that it's a steroid hormone. It can go through membranes and make effective changes. Vitamin D has the active form called 1,25-dihydroxy, and it says here that it comes from the kidneys, but in fact, we know it's not just in the kidneys, and it's also in the immunocells, and it can actually have an effective change in your immunocells themselves. So, let's talk a little about how this happens. So, according to this study, there is basically two ways you can get vitamin D into your diet, by the food and by the supplement. And it's found in food, in fish oil, certain type of mushrooms, and also egg yolk. Or the other way, from the sun. The majority of people get vitamin D into their system by the sun. Why is that? Because ultraviolet B radiation go down deep into the skin, where is it converted into pre-vitamin D3 and then finally into the vitamin D. Now, that vitamin D3 after it's produced by the sun goes to the liver and the 25-hydroxyl gets. This is kind of like the storage product in your body because it's fat soluble and it's stored in the fat cell. Then when it's needed, it can either go to the immuno. This is item where it's converted into 1,25-dihydroxy vitamin D, which is the active form, or it can go to the kidney and it can be converted there to 1,25-dihydroxy vitamin D. Well, the one in the kidney is usually used for metabolism, and in fact, they found many vitamin D enhances the antiviral activity of the lung cells. Here in this video, you can see the different studies that were done in many types of study. Did the study says yes, vitamin D had a benefit, or no, vitamin D didn't have a benefit? Here are 3 studies that supported the relation between vitamin D status and more severe respiratory disease, which is COVID-19. First, this is a study that had conducted to examine if vitamin D level is associated with COVID-19 results before the pandemic done in Chicago. So, there was a 7% decrease in risk for seasonal respiratory infections when researchers at the University of Chicago Medicine reviewed the health record of almost 500 people who had vitamin D testing within the previous year. They found that the relative risk of testing positive for COVID-19 was 1.77 greater for vitamin D deficient patients. But compared to those who were not, 2/3 of the study participants were non-white and 47% had BMI greater than or equal to 30, which is considered obese. Here is another study looking at the very same in terms of vitamin D levels in the hospital and outcomes. Okay, so what does this study show? It shows that potentially vitamin D levels are associated with a worse outcomes or worse course of SARS in the hospital. So you can see that when they divided the patient between vitamin D less than 12, which is a pretty low, versus greater than 12, you can see here that the survival probability in these patients when they set it to 12 was a huge difference in terms of survival. When they changed it to 20, you can see also there was still difference in survival, but not the same degree, and of course they followed them out for about 100 days in this trial. So once again, vitamin D levels seems to be associated with a worse progression of the course of COVID-19 in the hospital. The last study looks at vitamin D in COVID-19 to more specifically. So we know that incidence in case fatality rate, or CFR, of COVID-19 infections is increased in patients with chronic disease. According to this study, patients with diabetes, hypertension, heart failure, and COPD are at an increased risk of being infected with COVID-19 and having an increased fatality rate. As with higher level of pollution, and we have also seen that case fatality rate is increased infection with complication and chronic disease. What's very interesting is that vitamin D levels are inversely correlated with many of these factors. So what I mentioned here, what things is said in this study. In addition, in this article entitled Evidence that Vitamin D Supplementation Could Reduce Risk of Influenza and COVID-19 Infections and Death, which was published in the journal Nutrition in 2020. And here is a table from that article, and this table is entitled How Vitamin D is Related to the Clinical and Epidemiological Findings for Incidence and Case Fatality Rate. So here are the characters, the acute disease, and some complication. And here is the relationship to level of vitamin D, or 25-dehydroxyvitamin D. And looking at this table, we can see that many of these complications and chronic disease have an inverse relationship or inverse correlation to vitamin D level. So, some of them include severe cases associated pneumonia, increase the risk of sepsis, risk of heart failure, diabetes, and we can also see it with increasing case fatality rate for certain patients with certain acute disease well. And most of them are associated with an inverse correlation to vitamin D levels. That means that acute disease and complications and level of vitamin D go in opposite its directions. What does that mean? That means that having increased incidence and case fatality rates and having these complications or acute disease, these go up, your vitamin levels go down. They go in opposite directions, and what's important here is inverse correlation doesn't equal causation, which means that can't say this causes or that low vitamin D levels cause the complications. We know they are associated, but we don't know how they are associated. And as these go up, vitamin D levels go down, and vice versa. As vitamin levels go up, these go down, which means that vitamin levels can help to prevent acute disease. At the end of this video, these studies showed up that there is a relationship between vitamin D and COVID-19. So I can't tell you as an individual how much vitamin D to take, because I am not your doctor and I am not here to give you a medical advice. But I am still going outside under the sun, and my level was under the normal range. Well, even I am living in a sunny city. Be careful and check your vitamin D levels to increase your immunity. Thank you for watching, and thank you for joining me.